This video talks about assisted oral hygiene, toothbrush tracking, and why it matters. The main service that we offer is called assisted oral hygiene. With this, we have a CSI hygiene student or a trained caregiver go in approximately once per week to help the resident and caregivers with brushing and cleaning between the teeth. Sometimes these providers provide hands-on help. There are some residents that need a lot of hands-on help. Sometimes all the resident needs is some checking, coaching, and helping get to the harder-to-reach areas. Assisted oral hygiene is never forced. We respect the resident's choice to refuse services, but we may ask a couple times before we give up. The resident is responsible for purchasing their own oral hygiene supplies. Sometimes we put together an initial custom kit for the resident. When funding is available, we continue to provide some easy-to-store items. We typically do not supply toothpaste. Assisted oral hygiene is a supplemental service that takes place approximately once per week. It is done in addition to the regular help with oral hygiene that the facility provides on a daily basis. We are also piloting a program utilizing a toothbrush fitness tracker to facilitate brushing documentation and encourage more regular brushing. The tracker and app look like this. There is a hub that plugs into the wall, then the tracker fits conveniently on the toothbrush. Here's a snippet from their promo video.
Introducing the Toothbrush Connected Oral Care System. It's a fitness tracker that connects to your toothbrush. Every time you brush, it automatically detects what you're doing well and how you can improve.
Here are some examples of the data we collect and how we use it to improve brushing habits. Notice here we can see the frequency of brushing events, and it's separated into morning and night. Notice with this patient, you can see a visual improvement in the frequency they're getting their teeth brushed per day. Starting out, you could see about once per day, and now we're moving to about twice per day, sometimes even more. This data not only shows us what is going on with their toothbrushing, it also enables us and empowers us to set personalized fitness goals for their toothbrushing. We can strive for improvement no matter where someone is currently. For example, this resident only brushes their teeth or has their teeth brushed a few times per week. The goals for this resident will be drastically different than the goals from the previous resident we were looking at. The important thing with goals is that they are realistic, obtainable, and measurable. And with this, we are able to bring that realistic component more into play. It's also important to note that if a day records no toothbrushing events, we want to see why that occurred, because that may not mean that their teeth were not brushed. It may mean that it was brushed with a different toothbrush. So in this chart, you can see a trend of a decreased frequency in toothbrushing events. When we look at this decreased frequency of toothbrushing events, what we want to ask ourselves is why. Is there something in this person's mouth that's bothering them that makes them less cooperative with brushing? Or perhaps their toothbrush hub is getting unplugged because they want to charge their cell phone or something like that. Another thing we may want to consider in these situations is that they perhaps have a different toothbrush that they use on the days that our team member is not out there. Because the trackers only work if you use the toothbrush that has the tracker on it. Now you can move that tracker from one toothbrush to another toothbrush if you do prefer to use multiple toothbrushes. While our current focus is on frequency of brushing events, these trackers can track way more than just frequency. For example, this chart shows the duration of each individual brushing event, and this can be shown by clicking on those brushing events. The tracker also tracks the position of the toothbrush and where it is in relation to your mouth, so it can show you the areas that you need improvement. As we move forward and we work with these trackers more, we're going to look at not only the quantity of brushing events, but also the quality of those events and focus on how we can educate our caregivers, our residents, and our families to provide better oral home care. These awesome trackers are not only documenting when we go out and provide assisted oral hygiene, they're also tracking the brushing events that occur from the dedicated providers and caregivers at the long-term care facilities. Our team is currently working on developing a rewards system that will categorize patients based on their frequency of brushing. A patient can be gold, silver, or bronze. Regardless of what status they are categorized in based on their frequency, any type of improvement can allow the residents to earn prizes and motivate them to improve their oral home care and their cooperation with their caregivers. Toothbrush tracking and assisted oral hygiene work very well together. However, they don't need each other, and they both can run as separate, independent programs. In our program specifically, here's how these two programs work together. We have our assisted oral hygiene providers, who are the trained caregivers or hygiene students from the College of Southern Idaho. They're going to be going out once a week to help with the brushing, the flossing, the cleaning between the teeth, as mentioned in assisted oral hygiene. Those same individuals are going to be monitoring the toothbrush tracking data, and they're going to be looking for trends. As they're looking for these trends, because they're out there once a week, they're going to help try to put some meaning behind these trends. When we suspect a problem, they're going to let Dr. Brooke know that this patient may have a problem. This communication will take place through a secure telehealth portal that allows for videos and photos to be transmitted. Upon reviewing the data, Dr. Brooke may recommend that the patient come see her in the clinic where she practices, which is the Family Health Services Advanced Delivery Dental Clinic. This clinic is located less than 4 miles from either facility that we serve. If necessary, Dr. Brooke also may come to the facility to see the patient in person before the patient is referred to the clinic. It is important to note that the Family Health Services Advanced Delivery Dental Clinic is a separate clinic from this program. Dr. Brooke is the same doctor, and she runs both programs. However, because they are different clinics, if you want to be served in both capacities, you need to become a patient at each clinic separately. Dr. Brooke strongly recommends that all participants are registered as patients for both clinics. However, she is happy to treat you at one clinic or the other if that is your preference. Your Special Smiles does not have the capacity to provide care at reliable and regular intervals, and therefore we recommend that you seek care at outside facilities as well. That dentist could be Dr. Brooke at the Family Health Services Advanced Delivery Dental Clinic, or could be any other dentist of your choosing. Dr. Brooke is happy to work with any dentist that you'd like to work with, and has performed a Google search here of other dentists in the Jerome area. This is not a comprehensive list, but just the first few that popped up. She's happy to work with anybody. If regularly scheduled off-site care is not a possibility for the resident, then the residents who are participating in our assisted oral hygiene and toothbrush tracking system will be given first priority when we have our irregularly scheduled professional hygiene services when they are able to come out to the facility. Our goal is to do what we can with our limited time and resources to improve the oral health and therefore the quality of life for the residents in the facilities that we serve. We believe that assisted oral hygiene and toothbrush tracking are two of the most important services that we offer. Good home care can help decrease the chances of oral pain, tooth loss, and even aspiration pneumonia. We believe that what a patient does at home to care for their teeth matters way more than what we as dental professionals do in the office. So therefore, even those who are unable to go into the dental office can improve their oral health by improving their home care. We would like to conclude this video by thanking the facilities that are working with us on this program. The facilities that are working with us on this program are truly some of the best facilities. They are concerned with the oral health of their residents, and they're doing everything that they can to help improve the quality of health and their quality of life. By embracing these innovations, these facilities are paving the path for all facilities to be able to participate in similar programs and improve the oral health and quality of life for long-term care facility residents across the state of Idaho.